posterior thoracic translation and anterior forward head translation. Did you know you stand like that? Okay, your whole body, Brian, is shifted like this and twisted several different planes. Let me show you how that's breaking down your health right now, okay? You got a right thoracic translation. Here's your pelvis, here's your breast cage. You shifted like this. Take a hose and kink it, what happens to water? Shuts off, exactly. Here's the kink right here on the right side. Okay, these nerves go down into your legs. That's why your foot's numb. That's why you're having knee problems. It also goes down in your pelvic organs. That's why you're having constipation, alternating constipation diarrhea. Okay, you got a left lateral flexion in your thoracic cage with an anterior left rotation. So your whole thoracic cage is smashed and twisted like this. It's like smashing a rock on your foot and wringing out a sponge. That's like creating a dam in the river. Okay, you got a big dam in the river right in here. You don't feel that, can you? Okay. Those nerves go around into your, not only your abdomen backhand, they go around your digestive tract. That's causing your pancreas to feel like you're on a roller coaster. It's also causing heartburn. That's where you get that burning pain up here. Now what's happening is your thoracic cage is shifted so your head's come back to center. We already talked about multiple car accidents, sports injuries. So your cervical spine is smashed and twisted on this side. That's a big dam in the river right up in here. Okay, those nerves go down in your arms and hands. You mentioned multiple shoulder injuries. Both hands go down. Hands get cold and you have a right elbow weakness. Okay? All right, now what we're going to do is we're going to check the balance centers of your brain and your neck to see if those nerves are injured and why you have those postural distortions. Fold your arms across your chest, close your eyes, raise your right knee up to your hip and stand there. Okay, positive straight leg raise on the left, 1 second. Do it on the right, 1 second. Okay, on the left, about 2 seconds. What's happening, you can feel how far off your balance is. So what's happening through all those sports injuries and car accidents, you've damaged the nerves in your neck that control balance and posture. It also is affecting the balance centers in your brain. There may be some permanent injury. We don't know. We have to do more tests. Okay, so we're going to check your lumbar range of motion. I'd like you to do is back and forward, touch toes. Any discomfort in your hip or back. Back, extension restricted 10%, right lateral flexion restricted 20%, left lateral flexion 20%. You can feel that right here. Feel how you have motion here, a little bit there, and then look at that. You hit a big dam in the river on that right side. Restricted motion causes your body to break down faster. So what I'd like you to do is have a seat. Here we're going to check cervical range of motion. Tuck your chin to your chest and just cover your neck back. All the way back, cervical extension restricted 80%, right lateral flexion restricted 30%, I'm sorry, left lateral flexion, the right lateral flexion right there. You can feel this bend like this, boom, you get a big brick wall in here, don't you? And then you go to the right, that's where it stops. Remember that loss of motion, these areas have been damaged, injured, structure, and posture is weak. And when you lose that motion, Brian, your body and your spine starts to break down faster. As your spine breaks down, your body's going to age faster. Okay, we're going to measure the nerve function, sensory function from your neck. These 3 nerves from your neck down your arms and hands. Hold your arms out. Tell me if one side's more sharp, more dull, equal to the other. Sure. Okay, hyperesthesia right to C6. Okay, we're going to measure the sensory function from 3 nerves down into your legs. More sharp, more dull, equal. Okay, we're going to measure motor function from your neck down your arms and hands. Boom, boom. Yes, boom, boom. Reflexes. Okay, so we go reduced reflex, C5 on the left. You're losing the motor function from the C5 nerve into that lift. And lay on your back. Okay, we're doing a number of tests. Test the disc integrity in your low back. Any discomfort in your back? Any discomfort in your back? Any your back here? Okay, continue your back here. Your back here. Your back here. Discomfort in your back here. Okay, face down. Okay, Ryan, we're just going to check your spine again. Okay, your whole pelvis is shifted out of position. You got a posterior left pelvic rotation. Your whole pelvis is stuck in this position. And what it's doing is taking your spine, twisting it back on the left side. You can feel this spasm right here. Pericardial spasm, left lumbosacral musculature. These muscles are in spasm because they're trying to splint those nerves from becoming even more damaged than they are. You have edema, posterior joints, L4, L5, S1. Those are weakening nerves down into your legs. That's why you're having numbness in your feet, the right knee problem, and left hip with alternating constipation diarrhea. Okay, whole thoracic cage, you got posterior rotation in your thoracic cage. These muscles again are in spasm right up in here. That rotation is smashing those nerves right there. You can feel that right there. These are nerves in your digestive tract, that's where you're having heartburn and problems balancing your blood sugar. Okay, you got spasm in your left trapezius muscle, actually bilaterally. There's more swelling right here, cervicothoracic junction. Those are the nerves down in your arms and hands. That's the weakness in your shoulders and elbows and numbness in your hands. Okay, you got suboccipital spasm on the right, the posterior inflammation line on occipital joint on the right side. Those are nerves that control metabolism in your system. That's why you get sinus problems and your energy levels are depleted. Go ahead and stand up. How long did that take? 6 to 11.
An hour.
Okay, how did that feel?
Awesome. No, it felt like you picked me apart.
Right, do you feel like I know your problem?
Yes.
Is there any question?